So if you don't want to have that inflammation at all, if you're going to the barber, tell them not to cut the hair so short, so close, because you don't want to have to deal with an ingrown hair. And if there's anything you can do, that's really it. It's really not cutting the hair that close and not cutting against the grain.
Kind of growing back.
Yeah, we're gonna want you to. We're gonna want you to come back to us to see. But there's things, not only the injections, but we have a laser. We have two types of injections: Keloids, 5FU. So, I don't know where you live, but if you're nearby and you can come back to see us, we can definitely do the injections if needed, or the lasers. We want you to use the creams post-operatively. And wherever possible, if you can, a silicone bandage. It's kind of hard with hair growing areas, but the more you can keep that silicone on, the better too.
Okay.
Where do you live?
North.
Okay.
What exactly is the radiation process?
It's just like an X-ray, essentially, and they'll sit you down, position you, create lead to block out the surrounding tissue so we don't radiate everything. We're just radiating the area we want to, and it's like an X-ray. You hear some beeping, there's no pain, and it's done. In your case, it'll be done in 1 day.
I had it for about 11 years, and it impacted me. I used to just wear like do-rags every day. Sometimes it was sweat real bad, so I couldn't really move freely. Yeah, I never tried removal from the past. I used to take a lot of injections to try to suppress the growth. My barber, he told me about you guys long ago. Not this barber that I'm with now, but a previous barber years ago. I believe it started with him, and then over time it just progressed. I would say reach out to a specialist. Do research before you reach out, so you can get an idea of what's gonna go on, what's gonna take place.
All right, we are happy to have everyone with us, and we have a wonderful patient who has decided to share his story, his journey with you. This, what you're looking at, is the back of the scalp, posterior scalp, back of the head, where a lot of us as men, we go to the barber and we get our hair, we get a nice fade or whatever kind of style cut, and they trim the hairs very close to the skin. Unfortunately, because we have curly hair, when that hair is trying to come back out through the skin, because it gets cut and then it retracts, when it's trying to come back out through the skin, it gets trapped and curls and becomes an ingrown hair. And that ingrown hair leads to inflammation. And if you're a keloid prone person, that inflammation is the nidus, is the start for the keloids. And you can see that his are up here, but they're also down in this area. All of these small little dots are actually new keloids that are forming that will eventually become this size or even larger. So what we're gonna try to do is, we can't remove all of this because there just isn't enough skin. So what we're gonna do is we're gonna remove the ones that are the most bothersome, try to remove as much of this as we can, and then we will irradiate all of this area that's exposed here. That will get some of these smaller satellite lesions to calm down and to not be so aggressive, and maybe even stop growing completely. We had some great success with that. So we're just gonna, right now, we're gonna make our incision on the top side here. And so and for those of you that don't like blood, the scalp is very bloody, so you will see quite a bit. There's the bulk, and you can even see some of the pus that's actually coming out right there. See that pus?
Oh man, wow, we can see that.
Yeah, that's pus. Because the hair gets trapped, and then there's little micro abscesses, and that's the foul smelling drainage that these people will live with on a constant basis. And yet the insurance companies want to say that it's not warranted to have this removed. Now the other thing is that we think that this is a keloid, right? But we don't really know for certain that it's a keloid. The only way to truly know is to have it examined under a microscope. Because on occasion, it's happened quite a few times in fact, the keloids have actually been cancerous. Squamous cell carcinoma, sarcomas.
So I really want to talk about kind of where keloids originate and why these commonly affect people of color. And so there is a question as far as can keloids be preventative? And I guess today's topic is talking about this specific area where men go to the barber shop and sometimes they end up lifelong having a keloid after a bad haircut or treatment. So is this something that can be avoidable, or is it a matter of the clippers they're using, or perhaps they're not sanitizing it? How can we kind of avoid this when we're going to the barber shop?
The honest answer is you can't. And it has nothing to do with whether or not the clippers were dirty. It has everything to do with just the person's genetic makeup. If you are genetically predisposed to get keloids, any inflammation will potentially start that keloid forming. So if you don't want to have that inflammation at all, if you're going to the barber, tell them not to cut the hair so short, so close, because you don't want to have to deal with an ingrown hair. And if there's anything you can do, that's really it. It's really not cutting the hair that close and not cutting against the grain. If you don't cut against the grain, then it's unlikely that the hair will retract. It's unlikely that it will retract and go beneath the skin. But if you go against the grain, then it will cut the hair shorter, and it will have a higher likelihood of going beneath the skin, and then you're fighting.
Now, I suppose the same could be said for women and the pubic area. That's a very sensitive area, prone to ingrown hairs as well, too.
Absolutely. And so if you can, in the pubic area, the nice thing about that is that we can do laser hair removal, and that would prevent you from having to get from shaving, which is what can lead to the keloid. So if we can do the laser hair removal, and we tell a lot of our patients that they need to prevent the next one from coming. So we want to make sure that there's enough skin, because one bend of the chin and now this can just pop open. And if it opens, it doesn't mean the keloid's going to come back. It's just, and it will heal usually very well. It's just a nuisance with wound care.
Now, someone asked a great follow-up question. They were asking, why do keloids itch so much?
They itch because they're growing. They're kind of, in order for them to travel to another area, they actually are migrating under the skin or deep in the dermis. And that migration is what you feel and which is leading to the itching. And sometimes it could be that the keloid has already trapped some hair follicles, and the trapping of the hair follicles might also itch as well. So there's a lot of reasons why it could itch. But typically it's a sign that it is growing. And they're painful because they are trapping the nerve endings in the scar tissue. And if you eat a salty meal, then it might swell, and now it's compressing on those nerves even more. If it starts to grow, it'll start compressing on those nerves even more, and now you have shooting pain that comes out of nowhere. Right, so next thing we're gonna do, this is PRP, platelet-rich plasma, and we took his blood, spun it down, separated the platelets from the serum and the red and white cells, and now we're putting those platelets back into the wound. And it will help stimulate, the platelets have a growth factor that helps stimulate the healing process. It leads to what we call angiogenesis, or the creation of blood vessels. So it gets oxygen faster and it has less inflammation as it's healing. There is better collagen being deposited, so it's a smoother incision. We use it for all of our cosmetic cases as well, because it makes the scars look like they've been healing for 3 months when it's only been 3 weeks. So it's really tremendous.
Now I want to talk a little bit more about the patient. Someone is asking, are they under a local anesthesia?
They are under, we did oral sedation, little cocktail, Valium, Benadryl, and Percocet. And then we also utilize local anesthesia, which we injected. You might have seen that at the beginning of the case, where we were injecting lidocaine with epinephrine to help control the bleeding and help with the pain. Ask away. I can answer, I will. If I can't, I won't.
We got a question on whether or not they can use silicone after the surgery.
We highly recommend it. Our kind of post-operative cocktail is using our 2 creams, Keloid Care in the morning, Scar Shield in the evening, just a small amount. It has a wonderful viscosity, so it's great to massage and use to massage into the incision. And massaging the incision line is very important to help telling those fibroblasts to lay the collagen that they produce in a flat manner. And then after each application of either the keloid care or scarcia, we recommend putting a silicone bandage on the area for as long as you can tolerate it. Not everybody can tolerate it all day. Some people can only tolerate the bandages for a couple hours. And then you can tend to gradually increase that over time. But yes, we definitely recommend that. In this case, it's going to be hard to do unless the hair is really short. In addition, the radiation is blocked by hair. So you're gonna see now, we're just gonna cut a little bit. We're not shaving, but we're just gonna trim a little bit so that the radiation can get to the area. We're gonna radiate this whole area here. And yes, the hair may not grow back, but usually it does, because it is superficial radiation. It tends to grow back at about 9 months or so. But it may not be as dense, and so it may be less keloidogenic. That's a word. This is now Exparel. It's a long-acting pain medication that we're injecting to help with the post-operative pain so that he doesn't need to take that many narcotics. So what we're doing now is just putting on the dressing. It's important for these, because the scalp is so bloody, to have a very tight, compressive dressing to prevent the bleeding.